All right, thank you. And as we have our panelists find their seat, we're going to roll right into our last session before posters and happy hour. But this session is an Earth's worth of new journals supporting planetary health, and it's moderated by Dr. Josh Tewksbury, Director of Colorado Global Hub from Future Earth. So give us 2 seconds to set the stage. Thank you.
I just need to know how to change the clock. I can do it, but I just need to know how she does it.
I think they do it from the AV.
Oh, you don't do it from here? Okay,
yeah.
Good. Well, you guys get it. As long as I'm not in control, that's fine.
Yeah, you're not in control.
All right.
You're going to get 4 minutes.
It's so hard. I worked on this to get it down to 4. It's really hard. I'm doing my best. I think I will. No, all right.
Is there enough water down there?
I'm good. I'm good. So I'll go up, I'll do the intro, and then you're up. Okay? I'm going to introduce you both.
But after the video, I'm going to be...
Yeah, I'll do the video first. Yeah. Okay. Should we get going? Yeah? All right. So I reckon... I'm not on yet. I can't go.
I think you need to press... Oh, no, when you screen. Yeah, go ahead.
Test. Nope. Okay, she'll let me know. I don't know where she is, so I'm just assuming I get a flag. Oh, you'll give me the thumbs up? Awesome. We'll get this done. Not yet. Test. All right, I'm here. All right, excellent. Yeah. All right. So, I know that I'm standing between all of you and happy hour. So I'm going to try and keep this on time. So, virtually all scientists contend that climate change is an established fact, and just under half of Americans believe this consensus to be true. And it's statistics like this that have led a lot of people to say that we're in a post-truth era, or that that people don't have had enough of experts. And this just makes my head hurt, right? This makes my head hurt because we are not in a post-truth era. Evidence still matters, data still matters, science still matters. They matter a lot, perhaps more than ever. But in this pivotal time period, we need scientists around the world and the data that they represent and bring to the fore to be more connected with the 7+ billion people that live on this planet than ever before in history. We need scientists and professionals working with businesses, working with city leaders to come up with solutions to problems that put evidence and data at the hands of policymakers and individuals so that decisions can be made about their lives and their futures. And nowhere is this more true in this field, in planetary health. The speakers I have the pleasure of introducing today have devoted their careers to making sure that the very best evidence in this field is brought together and communicated to the broadest possible audience. And this is a panel that is really quite close to my heart because this is also what Future Earth does. We bring researchers together from across domains and connect them with the most effective practitioners and policymakers, and we tell compelling stories. We tell compelling stories to drive transformation in the way we live on this earth because the facts are on the table, and that's what's needed. We have about the next 25 years to thread a needle that takes us from this world to a very different world. And so the question is always, how do you get there? And I think the answer is really in this room. It's by working together. It's by working together across domains and across disciplines and societal sectors. Future Earth is supporting networks coming together across all sorts of challenges, health being a primary one, but also including climate change and urban futures and sustainable production and consumption, and the way we track and value the natural assets we all depend on. We call these natural assets, and they're led by volunteers, many volunteers in this room, actually, who are at the top of their own careers, coming together to really help make this a human age we actually want to live in. Among these networks, Planetary Health is showing others this path. And I think that's because of the people involved primarily. And I mean, the people in this room today, actually, can I just get those people to stand up really quickly if you're a part of the development team or the advisory panel for this group, for the health network at Future Earth? I know there's about 5 oh, come on, there's more than Joy in the room. There's Chris. Howie's in the room too, I know that. We got Timmy's here. Where's Timmy there? Somewhere up. There's Timmy up top, right? Fran, Fanny, all of these people have come together along with folks like Andy Haynes, Peter Dizak, Tony Capon, Chris Ebi, Sarah Moulton, many others who couldn't make it here today to try and drive this forward. But there's another reason why this group's leading, and I think it's because this group kind of understands transdisciplinary work better than many other disciplines. And it's because your study subjects are also your loved ones, because you understand loss, perhaps better than any other discipline. And so the 23% of deaths that are caused by unneeded environmental causes, that hits home. That hits home and weighs heavy on this community, perhaps more so than others. And I think also it's also because of folks like I'll be introducing today, all pushing for the use of these sort of systematic reviews and other mechanisms that this community has led others in sort of this process of making facts matter. That is what the journals and the platforms we're talking about today do. They make facts matter. They provide opportunities for evidence to count. So I think there's one other thing I want to frame here is that also I think hope is about showing that solutions are out there. So it's this issue of hope itself. So you have to have networks and you have to have hope. And this is not just simply documenting decline, but really working on solutions, whether it's in science or in journalism. And tracking progress, showing what works, steering those that are behind towards best-known practices. And the speakers in this panel, they are doing this every day. They have been devoting their life to this every day. New journals, new platforms, and collaborations helping us to track our progress towards our most important goals. We need this in all fields. And one thing that's been said here today is also the need to tell compelling stories. So because this is a whole group launching magazines and platforms and journals, we got a new magazine as well that we're launching called Anthropocene, Innovation in the Human Age. We're also on our first edition. And this is just the very best evidence-based international independent solutions journalism, focused on solutions. Every day we dig through hundreds of journals to find compelling stories on sustainability and try and tell those solutions. So check it out. See what you think of that. This is actually a good segue then to introduce a series of speakers, all of which who have been working over the past years to bring something new to the scene, to provide the journals that provide the stage for this community to act on. And I'm going to start by introducing 2 people at once. Richard Horton, who's not here in person, but will be on video. And Richard probably needs not much of an introduction to this crowd. He is, among many other things, the editor-in-chief of a small local journal called The Lancet. Many of you might know. And he's actually, he's joined here in body as well by Raffaella Besorgi. Is that your name correct? Besorgi. Almost. So, I mean, I'm going to say a bit more about Raffaella because I don't know what you do with advanced degrees in environmental technology, neurosciences, and molecular biology by institutions in 3 countries. But if you're Raffaella, we can all just be super excited that she ended up where she is, which is the editor-in-chief of the Lancet Planetary Health Journal, and which just launched its first issue of this last month. So it's a great pleasure to introduce Raffaella, and I think Richard
Richard's going to be
on video. There he is.
Hello, Planetary Health lovers, and thank you very much for inviting me to join you today, and I apologize that I'm not there in person. But this is a truly exciting moment in the short history of Planetary Health. Perhaps I should begin by just briefly saying, where did this idea for Planetary Health come from? As we were ending the era of the Millennium Development Goals, several of us, contemplated, was public health, was global health quite right for the future that we were thinking about, sustainable development? And although those 2 disciplines are immensely important, we felt that there was a gap, that there needed to be something else. Right around that time, I remember reading Jared Diamond's great book, Collapse, and the whole idea of the fragility of human civilizations. And then if you connect those 2 ideas, the idea of fragility of human societies but also the need for perhaps a new science for sustainability. The Rockefeller Foundation at the beginning of 2013 had this wonderful moment where they invited people to think about the next 100 years. And that really was the spark, the catalyst for the idea of planetary health. Again, thanks to the Rockefeller Foundation, we launched a commission on planetary health that was chaired by Andy Haynes. We had a fabulous group of people come together to think about what planetary health was. And now inscribed, burned on my heart, is the definition, the health of human civilizations and the ecosystems on which they depend. We launched the Commission in the summer of 2015. And one of the challenges that the Commission set out was around knowledge, because we have these silos of knowledge in academic disciplines across our universities, our research institutes and our journals, where we don't really foster the kind of work, the kind of thinking that we need for this new era of planetary health. So one of the ideas that came from the Commission was, of course, the journal that Raffaella is there today to talk a little bit more about. The outcomes of the Commission have been truly extraordinary, I think, to all of us. We have the Planetary Health Alliance, we have conferences, we have programs, we have academic appointments. The first Professor of Planetary Health, Tony Capon, at the University of Sydney in Australia, fantastic achievement there. We have programs of education and research and funding, and now we have new journals. I think it's important to try and set out very quickly some of the features of planetary health. This discipline is not competing with public health or global health. Public health is very much about health protection, health promotion, health services within health systems. Global health looking slightly more at the transnational, the global forces shaping health. And then what planetary health is trying to do in combination with public health and global health is to broaden that discussion still further, to look at civilizations, to look at societies, and also to look at the link with the environment, ecosystems, biodiversity, and so on. We want to be inclusive. We want to be interdisciplinary in the way that we work. We want to show that we can respond, we can adapt to these new challenges. We can flourish in the face of these new dangers and jeopardies that we now face together as one humanity. But most of all, I think what we want to show is that we can create a new era of human cooperation. That's the goal of planetary health. Human cooperation, with the end being to protect and augment the strength of our wonderful biodiversity on this fragile planet that we exist on. Thank you and enjoy the conference.
So thanks a lot, Richard. So as many of you might have already seen, the Lancet Planetary Health was launched at the beginning of the month at CUGH. It will join the Lancet Public Health and the Lancet Global Health in providing a third pillar in this open access program that will be looking at the interconnection between human health and the determinants of health in our physical world. But what is the creation of a new journal means for the planetary health field? What type of science is the journal going to be seek? I think to explain planetary health in very simple terms, rather than repeat the definitions of Rockefeller Foundation, we need to think of humanity as the driving force behind the environmental degradation that we are witnessing today. The change to the climate, to the water, to the land, are really challenging our life on this planet. And, the implication, as we know, as we're seeing with all research going on, are huge for our health. So the planetary health calls for a multidisciplinary approach. The journal will be tackling the most pressing issues across health in relation to the natural resources systems. So we will be looking at infection diseases. If we think about main infection diseases like Zika virus or HIV or malaria have emerged as a consequence of loss of biodiversity. We will be looking at, of course, climate change, and to achieve the target that was agreed at the Paris Agreement, we need policies. We need new policies in place. We will be looking with the growth population. We will need a radical transformation of our nutrition and food systems, and the cities will need a transformation as well if we want to live in a sustainable way. Of course, it won't be all about climate change, because climate change is causing a threat, is representing a threat for us for reasons that are beyond environmental degradation. They are really weakening, make our global security weaker, and is causing human displacement. And in fact, the journal will be looking at indirect pathways as well, like poverty, conflict, and human displacement. So Planetary Health calls for a multidisciplinary approach, and the Lancet Planetary Health will give that type of place where this type of research can be published. So we are going to publish research articles, peer-reviewed research articles, commentaries, and correspondence, plus editorials, to make the communications of those research, which we are actually, today there was a conversation about how we communicate these complex ideas, complex scientific information in a way that policymakers can help to change things. We will publish commentaries linked to research articles that will help to explain in a better way what the main findings will be. So we invite you to submit the best and still missing science in order to build a more resilient future and to make the place where we live a better place for us, but for the future generation as well. Thank you.
Thank you. That's fantastic. So I have the honor of introducing our next speaker here, Brooks Hansen, who is the Director of Publications for the American Geophysical Union, and really the pilot for the launch of GeoHealth, which, like Lancet Planetary Health, just published its first issue last month. And I've had the pleasure of talking to Brooks about just the amount of work that has taken, and I'm really excited to hear more about it. Come on up. Speak.
Josh and everyone, thank you very much. Let's see, do I click to get to my slides? Yeah, okay, good. I actually want to frame this in a whole larger discussion. Then I'll talk a tiny bit about the journal, but actually some larger things on kind of how AGU views this field and how we want to work and collaborate and kind of help take the energy in this room and work with Planetary Health Alliance, all of you, in really catalyzing this science. And let me explain why and what at least some of the initial steps that we're going to do, obviously refined by further discussions. But first, there's an enormous amount of energy in this room, and I just want to give a shout out to what's going on around the world today, which is the Public Climate March. Oops, which is not that. And let's go back. Which is they didn't switch my slides. Okay, there was a bunch of funny posters up there from the Twitter feed today, and I just wanted to take a moment and shout out the march in Washington is listed as massive. It's about twice as big as they expected, about 150,000 people. Yeah, so let's thank our colleagues for doing that. That makes it 10 times bigger than Trump's inauguration. Humongous. Okay. But enormous amount of energy, and our colleagues are out there doing some of the things that we can focus on in here. I think Amalia's glad they're not here because that would be 100,000 people in this room, which wouldn't really fit. Oh, there we go. Thank you. Okay, so there are some good posters from the Twitter feed this morning. This was this morning. It got really big this afternoon. Okay, so just also to put this in context, last night, in preparation for the march, our government took down all the climate information site on the EPA's website. Last week, before the March for Science, our government fired our Surgeon General. So you put those two things together and we have planetary health. And that's kind of a backhanded compliment because you know you're important when our government starts denying that you're important. So we're important. So how do we take that energy, this energy, and build a community? And that's really where we want to be part of because, as many of we've heard today, this is bringing together different we need to bring together the best science from different communities, from different disciplines. We need to foster that science. We need to kind of change the whole culture. We need to build programs around that. And so how are we going to do that? And I think that's some of the discussion tomorrow, so just to give you some ideas on that. So a quick thing about AGU. We're almost 100 years old. Our anniversary is in 2019. We are called the American Geophysical Union. We haven't decided to change the term of geophysical, so we just redefined it to be all of science. So really geophysical is every other discipline of science rolled together now. And that's how the science has evolved. We have a humongous meeting in San Francisco. We spiked beer consumption in San Francisco during that week. We're also the largest publisher in the Earth and Space Sciences. We have 20 journals, 4 now gold access, open access, including GeoHealth. You might think that's an alternate fact if I say we're the largest publisher. You might say, well, Elsevier has more titles. Frankly, who cares about them? I don't. So we're also very strong in outreach to the public. EOS.org is a newsletter or a news magazine, or actually a news website now, that features a lot of our science news. It's true we started a journal, but we actually, through our council and board and discussions over the last years, have started a programmatic effort across AGU towards planetary health and geohealth. And this is not just a journal, but meetings and a great desire to build a community that's partly within AGU, but extends well beyond that. And the community within AGU will help drive the discussions and meetings and programs that we offer, but clearly we want to do this in partnership with many other societies and efforts. So we have a very broad definition of geohealth. It includes planetary health, but some other things that Earth scientists have been involved with for a long time, as well as ecosystem health, agricultural health, even human space travel or airplane travel. So there's radiation effects on many of you who flew here today, including me or yesterday. So we have started this journal, GeoHealth. It's open access. It's open for submissions. Just one of the first articles I'll mention is by Amalia and the others who put together this conference, and it's part of a collection of 28 commentaries that we pulled together across all our journals. They're all open. They're all open access. If you go to EOS.org, there's a commentary in there that pulls things together. But they're really about the discussion we just had, which is they're about how Earth science data and data about our planet at a local level to a global level is benefiting humanity in many ways that we don't appreciate. So many of the stories about how data are important and our science is important broadly, and this is really a whole collection. I think there are 28. You can call them a planetary health collection because in many ways they are. Okay, so these are the editors, the current editors of GeoHealth. Rita Colwell's the founding editor, and just a shout out to Rita, she just got the Vannevar Bush Award. It was announced that she got that last week, which is for a career public service. So Rita already has a number of awards, but another one recognizing actually her pioneering efforts in planetary health, her long work and her group's work on cholera, among many other interesting research areas. We also have another journal we started basically that's on the Anthropocene, Earth's Future, to distinguish it from Future Earth. We just didn't want to, we figured you guys had that name. So, but it is on the Anthropocene broadly, so it covers many related topics that I would call more climate change related. But for example, they just had a special issue on geoengineering to celebrate Paul the 10th anniversary of Paul Crunchen's seminal paper. As I mentioned, we're starting a meeting program. Obviously, we're thrilled to be here as a partner on this meeting and look forward to the next annual meeting here, but are working on a number of other meetings as well. Our fall meetings have had GeoHealth tracks and will again in 2017. Then this one's in New Orleans, an area where that's particularly important. Our ocean science meeting in collaboration with Oslo also has a variety of planetary health, geohealth issues. In June of next year, we're working with the Chinese Academy of Sciences to run an air pollution and PM 2.5 conference in Xi'an, China. Next September, we'll be running a conference on geopolicy, location to be determined, so keep an eye out for that. We'll have a Chapman conference, which is a small 100-person dedicated conference on hydrology and biogeochemistry of the Congo Basin, again with a lot of planetary health issues. And then we'll start actually our centennial with a fall meeting in Washington, D.C. in 2018. And I think one reason to encourage you to all to get involved with AGU, and I'll talk about how to do that now, is so we can help shape the program of that important meeting in Washington, D.C. So one of the ways to get involved is we've started a Facebook page on GeoHealth. This doesn't just cover the journal. We're trying to reach out and we'll cover what Lancet Planetary Health is publishing and other journals, PNAS, et cetera. We're also starting a community and invite you to join in for everything from job postings, new graduate student opportunities to community news, and we're going to try to, if you guys can see me afterwards, try to connect with other efforts, similar efforts and communities going on. We want to post the Planetary Health Alliance newsletter on this community page. So it's just connect.geohealth.org, and we'll loop you into the community, and it's a community where people can, if you're part of the community, you can post. So I'll skip over that as a matter of time. We're also, as part of this programmatic effort, hiring a program manager to help develop this and develop this program at AGU, and so please get the word out if you're interested here applying. It's at jobs.agu.org. If you have students, please get the word out to your students. We're looking at someone basically at a postdoctoral level who can connect and help work with all of you in this room to build this community. And a few other related efforts that are going on at AGU. We're very active in open data. We've had, actually, if you look on Wikipedia, you'll find AGU as one of the first publishers and societies to have open data policies. We feel, as those essays demonstrated, as discussed here, that the open data across the earth sciences worldwide are critically important for our future. We are very interested in gender equity. We're one of the groups, the societies leading a National Academy review on harassment in the sciences right now. And we have this thing called the Thriving Earth Exchange, which is actually supported by Rockefeller, among other funders, which is trying to connect scientists, funders, and local communities to help bring expertise into local communities to help them solve pressing problems about their community, whether it's adapting to climate change, securing clean water, dealing with city planning or urban planning, on how best to use scientific knowledge in their local solutions. So thank you very much.
So that was truly impressive, and a lot more than a talk about a new journal. So thank you so much for the sort of the expanded conversation about really what a model society, how it has expanded out from a core focus into all sorts of societal connections and the building that community. It is actually something that I think at Future Earth we're trying to learn from those best practices around the world to figure out how you do build this community around different sustainability issues and how you sustain that community so that they want to get together across the world, not just in person but virtually, to do work together. I think I want to make sure transition here to our last speaker. And I would say, our last speaker is both, a leader and a connector. Nick Watts is a medical doctor trained in both public policy and population health. He's the director of the UK Health Alliance on climate change, and he's also the executive director of the Lancet Countdown, the continuation of the 2015 Lancet Commission on Health and Climate Change. And I'm going to ask him to come to the stage now and tell us more about it.
Okay, so there you go. I am in the somewhat dangerous and definitely unenviable position of standing between you and, or being the last part of this organised program, standing between you and a drink somewhere outside. But if you had to pick someone to take that role, at least you picked an Australian, because you know for sure that I'm on your side when it comes to that. I'm going to talk through, for the timer tells me 7 minutes and 36 seconds, a little bit about, not all of Planetary Health, but one tenet of it that we're working on with this research platform, the Lancet Countdown, tracking progress on health and climate change. Maybe talk a little bit about how we got to where we are today, and throw a few thoughts out about where we might be going in the next 5 years, maybe in the next 10 years if we get ambitious. So I won't cover anything about the health impacts of climate change because that would be inappropriate, given that most of the people in the room probably know a fair bit more about that than I do. And even if I was going to, that diagram probably wouldn't help me very much. But what it does do is it reminds me of some of the key messages from the first sort of publication in this series, the 2009 Lancet Commission on Health and Climate Change, which really focused on the health threats and the impacts, and the complexity of this diagram reminds me of what we get really concerned about, these multi-hit scenarios. What happens when you start to wear down at a community's sort of local resilience, when you get hit again and again by flood, by the spread of sort of new infectious disease, when you start to wear away at the resilient capacity of what should be an anchor of good health, the health system. I also won't talk through the health co-benefits of mitigation or the response, and again, if I was going to do that, this diagram would probably not help me do that either. But it does remind me of the next of those two publications, the 2015 Lancet Commission on Health and Climate Change. And it reminds me of, I think, the three sort of, for me, the most salient message that came from that work, which was we looked at all of the different things you might want to do to respond to climate change, and we asked the health professionals on the commission, what do you think of this? And they said, well, all of this looks like it's pretty good for health. And then we asked the engineers and the sort of transport experts and sort of urban spatial infrastructure experts, and they said, well, actually, a lot of the technology that you need to do this, that exists. We're fairly confident that it exists, and we can roll that out over a time period that is very possible. And we asked the economists and the finance experts about how you'd go about doing some of that, and they said, actually, it doesn't cost that much, and you're going to get a lot of that money back, probably more back, in health savings and in sort of strengthened economies. And that, to us, sort of summarized, or I summarized the 2015 work in this sort of statement that the response to climate change has the potential to be the biggest global health opportunity of this century, but it is so incredibly possible. It's no longer a technological, a technical, an economic, a financial issue. It is now entirely a political challenge. And so that brings us to this slide. This is, if you haven't noticed the sort of trend, my slides are mostly just sort of pictures of logos or complex diagrams. The story so far brought us from, on the one hand, in 2009, climate change is this terrifying threat to human health and to the progress we've made in development and public health over the last 50 years. In 2015, the response to climate change is this opportunity. And all of this happened in the context, or is happening in the context, of what is perhaps a challenge to evidence or to science as some sort of decision-making tool for public policy, right? This sort of rise of populism that I think we started to see over the last couple of years. And it's also happening in the context of the Paris Agreement, this remarkable framework which is set out in 2015, which is exactly that, a remarkable framework. And it becomes a remarkable opportunity if we go through and implement that. To the friend of mine in the room who is calling me, presumably trying to put me off, it didn't work. Thank you, though. And that was the challenge set to us, was, okay, by the Lancet, build a platform, go away, build a platform that can respond to this, that can tell the story of climate change as a threat, but the response to climate change as an opportunity. Track countries actually delivering that, actually realizing these opportunities, and do so in a context of the Paris Agreement, tracking that as it is implemented, but also in the context of, a world that is questioning the role of science in public policy. And in many ways, what we came up with is a pretty well-worn public health tool. It's a sensible sort of response for a doctor, a nurse, or a public health professional is to gather the evidence, to assess that within the context, and then provide recommendations forward for their patient or for their city or for their country or world, as the case may be. And so that's exactly what this collaboration does. We are a large platform of, I think, a few too many logos right the way around the world. Many of the collaborators and sort of lead researchers in the partnership are in this room, and I think we've heard from quite a few of them today. Principally an academic collaboration with a few UN agencies, as you can see, thrown in there. 2 strategic partners in Wellcome and The Lancet that sort of make all of this possible. What it is that we're doing is, on an annual basis, tracking a whole range of indicators of progress on health and climate change, reporting them every year in the medical journal, The Lancet, which I think most of us should have heard of by now. It's probably been the one feature that I've heard mentioned in every single presentation so far today. And these are the sorts of indicators that we're tracking. We have in October coming up a whole series here. We have people from each of our working groups, which we split our work up into. So the health impacts of climate change, the response side, looking at sort of health resilience and adaptation, the health co-benefits of mitigation, the economics and the finance, and the political and the broader context. There's a few caveats that I have to put up around some of these indicators, which is that when we sat down to look at all of this is a complete list of everything we'd like to track. Now, as it turns out, the world's a complex place, and data, as we've heard, isn't quite as good as we'd like it to be. And so one of the key tenets of this project is that we're existing to get started and not let the perfect be sort of the enemy of something that's possible. We have to get out today and sort of push out our first publication for 2017, and it's going to be a very good sort of first effort. But I suppose what I'd like to caveat it with is each of these indicators are, in their own way, their own sort of research project going forward, and we're going to work on developing them and getting better at pulling all of that together. As well as that, we recognize that tracking some of this at the global level leaves out some aspects of the relationship between health and climate change, and there are certain things that don't necessarily lend themselves to global level or national level indicators. And so we as well have a series of national reviews, 4 pictures for 4 national reviews that are in the works at the moment. Mental health in small island developing states, coal phase out in China, the health benefits of meeting the UK's Climate Change Act, and phase out of diesel in Tehran. And these are sort of trying to really drill down into some of the policy responses and the sort of initiatives that, that perhaps give life to these indicators. So I'm going to finish up pretty quickly. Just to talk, maybe posit some of the places that we're going to head forward in the near future. Like I said, each of these indicators is its own research project. Ideally, we're going to start by looking at a lot of state changes, a lot of process-based indicators. Ideally, we'd like to develop these into a place where we start to get towards the actual fact, towards the health outcome. But you have to start somewhere, and like we said, we're not going to let the perfect sort of be the enemy of the possible or be the enemy of getting us started with this platform. And to do that, I think we need to start thinking pretty seriously about the data that we're drawing in. Some of this is going to be top-down, and some of it's going to come from some of the UN agencies that we work with. Some of it, though, is going to have to be built from the bottom up, and there are all sorts of infrastructures that have to be put in place to try and enable that going forward. We're also going to start thinking a lot more seriously about the communications of some of these indicators. Putting up slides with all of those indicators or writing even a paper about all of that probably is going to bore most people, because I agree data can be boring. But it can also be really interesting if you can bring it to life. And so those visualizations, putting a human face on what we're looking at, and providing simple messages, really simple messages, and repeating them again and again is going to be something that I think you'll hear a lot from this platform. And the final thing I think that we're probably going to have to sort out is, I haven't heard it brought up today, but the correct pronunciation of data. And so as well as the paper in October, as well as the 4 national reviews, you can also expect a paper, probably just from me. I imagine I'll be the only author on that. Maybe we have another Australian in the collaboration on that. To finish up, This is our platform. It's designed to sit at the heart of academics, of communications, and of policy, providing decision support, impact evaluation, but also clear communications with a robust evidence base. It can go in lots of different directions, as you can see, and we welcome all sorts of suggestions and input, and people haven't been shy with that, so thank you. But I suppose a little word of caution or a warning. For those of you who do come with suggestions or ways that we can improve on this, the immediate response is, thank you so much, can you help us do it? And so we're a very open, very collaborative platform, and we're looking to develop this going forward, and we need help. And so I'm going to finish on that, but thank you very much.
So this is an impressive group to be moderating. I am really glad that the piece of the magazine I waved around isn't in direct competition with any of these people. I will say that we're working right now to start a Planetary Health beat within that magazine that might help in the communications, the direct to the public communications the journalists can provide to help frame the conversations more broadly. But I think we have about 10 minutes at this point for questions for the panel. And so if people would like to come to the mics and ask some questions, I would encourage that. A brave soul. Thank you.
Nagash Taklu from Ethiopia. It's important that the Planetary Health needs a joint advocacy, a joint move. So towards that, 4 of you, how is your partnership? How is your collaboration? How is the value added among yourselves in bringing the planetary health challenges and successes in a joint way?
Maybe I'll just take one more question because there's someone else coming up, and then we can do them both at once. Go ahead.
Yes, related to that question, what I love about this meeting is we come to it from a whole variety of disciplines, but that many things can get lost in translation as well. And I'm wondering what we're doing as a project to be able to understand each other's professional languages and all get along.
That's great. Do you want to capture those two, and I'll do the next set? Anyone?
Okay, so certainly I think I tried to emphasize in my talk, at least AGU views our effort, and I think I illustrated through the meetings and so forth, as a key development is through partnerships. So we recognize that we bring expertise in geophysics, and even though that's defined as every science, there's still some sciences that are probably we're more expertise on, and that fostering planetary health, geohealth requires bringing those communities together. And so we view, and we have actually many of our journals are in partnership with other societies, and we'd be even interested in developing geohealth in such a partnership, and particularly on the meeting program and the broader kind of community building program has to be done in partnership with others. So we're all for that, and for fostering this science broadly. And I think in terms of the journal, specific journal space, I think there's certainly a lot to go around. That's one reason I think we all started these journals as open access, recognizing that we need to break disciplinary barriers, and that's the fastest and easiest way to do that.
Well, I will comment to try to answer the first question. I see the emergence of all these new journals on planetary health as a very good thing. Next year, at the beginning of next year, there will be another Nature title being launched, Nature Sustainability, and I don't see all these journals competing in a way between each other. I think that as a new reality is emerging, planetary health must be seen as an opportunity, an exciting opportunity for the publishing world as well, to come up with as many journals as possible, because we need the science, and as scientists need a place where to publish their research. So it's a great excitement. And also I'd like to comment on the fact that being planetary health, a multidisciplinary, a transdisciplinary approach to we need to actually, the Lancet Planetary Health is very much strongly, trying to do that, to bring all variety of disciplines that traditionally health researchers have not worked with before. So, and increasingly we will have to work with climatologists, with energy specialists, with agricultural scientists, with hydrologists, and so the journal will aim to actually catalyze alliances between all these categories to link the environmental scientist world to the public health and then to the policy world to actually, make a case for policy action for planetary health.
The only comment to respond to the second question. Absolutely, and I'm sure sort of almost inherent in being at this meeting, everyone here understands how difficult and how rewarding cross-disciplinary research is. For the countdown, our response, or the way that we sort of doing this, is exactly the point that was made earlier on in the day, which is we're building long-term relationships. It took us 3 or 4 years, to get started with this, and what we have here is a community of people from every discipline that is now used to each other, used to each other's language, and used to sort of working together. But it wasn't always like that. We had all sorts. We broke windows, we broke tables, we were shouting at each other. It took us 2 years just to sort of, just to get used to that. And I think that hasn't gone away. That's the thing that makes that possible is probably the personal relationships. The thing that sort of keeps this going and lets the economists and the engineers and the doctors talk to each other on a regular basis is the personal relationships that sort of transcend the different disciplines and transcend the sort of political tensions that we face. So I think that's really important.
Right. Great. I think I'll take a few more questions. Let's go one there, and then we'll go back and forth a bit. Start.
Okay. My name is Federico. I think my question is kind of related with what you already answered. I have a background in engineering and anthropology, and I'm always wondering about the role of social sciences and about qualitative research. And in these big scales, when we're talking about planetary health and geosciences, I always wonder, do you see room for qualitative research, and what sort of qualitative research? Because it's hard to think about these kind of things, and for us, social science is very challenging to publish in environmental science journals. It's possible, but I'm just wondering about that.
That's great.
Thank you.
Go ahead, sir.
Yeah. I think the one thing we all agree about is the need of transdisciplinary, cross-disciplinary, interdisciplinary. You mentioned this, and joining the dots. This is all conceptually very convincing, but in the hard realities of writing proposals and writing submissions for papers, you get penalized for doing it. You get reviews back, lack of focus, it doesn't come together. So did you change in your planetary and more planetary health journal, did you change the review process? Because if you give it to an economist, he will say, no, this is not really hard economics. You give it to a nutritionist, no, this is not how we do it. So you have to change the review process. Otherwise, all these lofty declamations remain lofty.
Okay. Can I just get one more, and then we'll do 3? Thanks. Yeah, go ahead.
Yeah. My name is Nicole DiPaola from Global Health Asia Institute. And first of all, thank you for this meeting. I think one of the most important outcomes is to build these personal relationships and build trust, and that we can feel energized to do things because the signs are not good. So my question is, what do you mean when you talk about better communication? Are we talking about, we are all excellent writers and scientists, so I think we have good research. So is it about different, you said about commentaries, it's about new tools, new mechanisms. Can you give examples what would be better communication? Thank you.
And I'm going to ask the panel to be brief just because I want to get the last 2 speakers in, and that's the end of our time. So, yeah. Go ahead.
I will comment on the last question and the one before. So in terms of better communications, what I meant is that you as a scientist, as a researcher, will have to, write a paper and, give an analysis of the data you actually produce, and that's fine. What I meant by helping the author to communicate better is that, lean commentaries written by specialists will help the communication of the findings of the researcher to be actually perceived to people that not necessarily are specialists in the field. And at The Lancet, we got a very strong department, marketing communication department, that will help the author, once the paper is published, to promote and to actually better communicate the findings. This is what I meant. But you, as a scientist, as a researcher, as a physician, you know, you're doing perfectly fine, and you know, you're doing your research, and you are actually presenting in the best scientific way. And then the journal will help you in making this more understandable by the community that not necessarily is specialized in planetary health field. To comment on that question, so we haven't changed the review process. We need to, and I'm talking in terms, you know, the Lancet Planetary Health has been launched at the beginning of the month. So few days, the second issue will be live. I'm telling you that to put this together, it was one of the hardest things I've ever done in my life because of the review of, you know, it was hard to find reviewers who wanted to review this. And this takes me to the comment I made before. Hydrologists don't know that the Lancet Planetary Health is going to actually be looking at transdisciplinary research and multidisciplinary research. And the comments I got in these months, why do you want me reviewing this paper? I'm an hydrologist. What is the Lancet doing? So my role as an editor will be, and is right now, the role to actually, you know, talk to these people and say, listen, you got such potential know-how as an hydrologist, as a climatologist, as a, you know, economist, and all put together will help us to actually publish multidisciplinary research. So we haven't changed the review process. You need to change as well. You need to open your mind as an hydrologist when you receive a paper that not necessarily looks at hydrology mainly, but looks. For example, we published this paper on a modeling paper on how dietary changes, you know, can be modified in India because of the freshwater constraints. So one of the reviewers I had for this paper said, "Why shall I review this? This is so, you know, is a new thing for everybody, and we need to talk to each other and to communicate and." Yeah.
Great.
So, you know.
Let me just make 3 quick points. Social sciences is absolutely critical. Social sciences are undergoing a data revolution of their own right now with a whole bunch of new data streams coming in, and it's absolutely critical that we integrate the social sciences into the other sciences as we develop applications and translate research for society is absolutely critical. Earth's Future, to get to the second question, the way AGU does it, we have volunteer editors for all of our journals that are researchers in the community. So Earth's Future, for example, has a very diverse editorial board. It includes geologists, ecologists, social scientists, economists, all on the editorial board. And so they talk together about that problem exactly. GeoHealth is the same sort of way. We have a model for that includes health scientists, earth scientists, ecologists and so forth that cover that discipline. So, but I agree that we also need this community to develop because you all will be the future reviewers for these journals, and so just aware of that problem. And the last problem, we've also started plain language summaries in all of our papers and are starting a variety of outreach using them and other tools like Reddit AMA and other things like that to start not just the commentaries that we're doing, which are also all open access across all our journals, but to start using those other tools to provide broader outreach of the science.
Shall I comment quickly, or would you like me to not?
Well, I'd love to get these last 2, and then maybe you can catch one of those, because they've been waiting so patiently. So go ahead and ask those last 2 questions.
I'll actually cede my question. It was mostly related to the review process.
Okay, great. Thank you so much. And, sir.
Steve Luby from Stanford. Back to Rafaela. I really appreciate Lancet and other journals stepping into this space, because it's really important that we have an opportunity to put this work out there. And I can say, as others would likely agree in this room, it's really difficult often to get traction and to get people who will understand interdisciplinary work. Interdisciplinary work requires that we touch different literatures, different knowledge bases, and it requires a lot of communication to get it through. Yet I see a tension when you have a 3,000 word limit and a 30 reference limit on Lancet Planetary Health. I mean, I have used, in my lab group, we call it an anti-intellectual stance. I mean, is there a way that we can break out of the health model of saying...
But we can make exceptions. For good papers.
Okay. You touched on something
So
here.
can I say something? I agree completely with that. There should not ever be a limit on references. We need to get references out of the supplemental material and into the main paper so that they can be indexed and caught by reference services so people can get credit for creating data sets and code. There's best practices around reference citation that I'm sure the Lancet has signed on to on Force 11 and that many other publishers do. And we really start to have practicing what we preach on references, because we should not be limiting references in publications. If you do it in print, I used to be at Science, and we limited it in print, but we did not limit it online. Right. So you can have a full set of references online.
Thanks. Thank you.